Welcome back to Calm Mind and Healthy Body, our channel, where we discuss important topics related to men's health. Today we're diving into the realm of sexual health and exploring 5 scientifically proven ways to prevent erectile dysfunction naturally. Erectile dysfunction is a common issue that many men face, but the good news is that there are effective ways to address and prevent it. Maintaining good sexual health is crucial for overall well-being and quality of life. Sexual health is not just about physical pleasure, but it also plays a significant role in emotional and mental health. Erectile dysfunction, also known as impotence, can have a profound impact on a man's self-esteem, relationships, and overall happiness. Addressing this issue proactively and exploring natural ways to prevent and treat it is essential. Erectile dysfunction is more common than you might think, affecting millions of men worldwide. It can be caused by a variety of factors, including stress, anxiety, underlying health conditions, and lifestyle choices. The good news is that there are effective treatments available, and by making simple changes to your lifestyle, you can significantly reduce your risk of developing erectile dysfunction. In this video, we'll be discussing 5 natural ways to prevent erectile dysfunction, backed by scientific research. Our goal is to provide you with valuable information and practical tips to help you maintain optimal sexual health. So if you're interested in learning more about how to prevent erectile dysfunction naturally, keep watching. Erectile dysfunction is a common condition that can have a significant impact on men's health and relationships. Understanding this condition's causes, symptoms, and effects is essential to address it effectively and improve overall well-being. A combination of physiological and psychological factors can cause erectile dysfunction. Physiologically, issues such as poor blood flow to the penis, nerve damage, hormonal imbalances, and underlying health conditions like diabetes or heart disease can contribute to erectile dysfunction. On the other hand, psychological factors such as stress, anxiety, depression, and relationship problems can also play a role in the development of this condition. The most common symptoms of erectile dysfunction include difficulty achieving or maintaining an erection, reduced sexual desire, and performance anxiety. These symptoms can profoundly impact a man's self-esteem, confidence, and overall quality of life. It's crucial to recognize these signs and seek help from a healthcare provider for proper diagnosis and treatment. If you enjoy our content, we'd appreciate it if you could subscribe and hit the notification bell so you never miss an update on health tips, recipes, and wellness inspiration. I appreciate your support. If you are experiencing symptoms of erectile dysfunction, it's essential to consult a healthcare professional for a thorough evaluation. A healthcare provider can help determine the underlying cause of your condition and recommend appropriate treatment options. Ignoring erectile dysfunction can lead to further complications and negatively impact your physical and emotional well-being. Remember, seeking medical advice is the first step towards regaining control of your sexual health and improving your quality of life. When it comes to preventing erectile dysfunction, there are several scientifically proven ways to maintain optimal sexual health naturally. By incorporating simple lifestyle changes and healthy habits, you can reduce your risk of developing this common condition and enhance your overall well-being. A balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can promote cardiovascular health and improve blood flow, essential for erectile function. Regular physical activity, such as aerobic exercises and strength training, can also help maintain a healthy weight, reduce stress, and enhance circulation, contributing to better sexual health and function. Stress is a common factor that can contribute to erectile dysfunction. By incorporating stress management techniques such as mindfulness meditation, deep breathing exercises, yoga, or engaging in hobbies and activities that bring you joy, you can reduce stress levels and lower the risk of experiencing sexual performance issues. Getting an adequate amount of sleep, avoiding excessive alcohol consumption, quitting smoking, and maintaining a healthy weight are all critical factors that can positively impact your sexual function and overall well-being. When it comes to managing erectile dysfunction, there are various treatment options available, and urologists play a crucial role in diagnosing and treating this condition effectively. By understanding the different treatment modalities and seeking guidance from a urologist, individuals can find a personalized approach to address their erectile dysfunction. Medications such as phosphodiesterase type 5, PDE5 inhibitors, including Viagra, Cialis, and Levitra, are commonly prescribed to help improve blood flow to the penis and facilitate erections. In cases where medication is not adequate, urologists may recommend therapies such as penile injections, vacuum devices, or penile implants. Surgical interventions, such as vascular surgery or penile prosthesis implantation, may also be considered for individuals with severe erectile dysfunction. Urologists are specialists who are trained to diagnose and treat conditions related to the urinary tract and male reproductive system, including erectile dysfunction. Consulting a urologist is essential for obtaining an accurate diagnosis, discussing treatment options, and developing a personalized plan to address erectile dysfunction based on individual needs and preferences. It's common for individuals to have concerns and misconceptions about erectile dysfunction treatments. Some may worry about the side effects of medications, the effectiveness of therapies, or the invasiveness of surgical procedures. Consulting a urologist can address these concerns, and accurate information can help individuals make informed decisions about their treatment options by exploring the various treatment options available for erectile dysfunction and working closely with a urologist. Individuals can find practical solutions to manage this condition and improve their sexual health and quality of life. Premature ejaculation is a common sexual issue that can have a significant impact on sexual health and relationships. By exploring effective techniques and strategies for managing premature ejaculation, individuals can improve their sexual performance and enhance overall satisfaction in the bedroom. Several techniques can help individuals control premature ejaculation and prolong sexual activity. The stop-start method involves pausing sexual stimulation when nearing climax and then resuming once the urge to ejaculate has subsided. Pelvic floor exercises such as Kegels can also strengthen the muscles involved in ejaculation control, leading to better ejaculatory control and increased sexual stamina. Open communication with both partners and healthcare providers is essential when managing premature ejaculation. Discussing concerns, preferences, and goals with your partner can help create a supportive and understanding environment that promotes intimacy and trust. Seeking guidance from a healthcare provider, such as a urologist or sex therapist, can also provide valuable insights and personalized treatment options for addressing premature ejaculation. In addition to techniques and communication, other tips can help improve sexual performance and satisfaction. Maintaining a healthy lifestyle, managing stress, and exploring new ways to enhance intimacy and pleasure with your partner can all contribute to a fulfilling and enjoyable sexual experience. Experimenting with different positions, incorporating sensual activities, and focusing on mutual pleasure can also help create a more satisfying sexual connection. By incorporating these strategies and tips into your routine, you can effectively manage premature ejaculation, enhance your sexual health, and cultivate a more fulfilling and enjoyable sexual relationship with your partner. Recognizing the symptoms and warning signs of erectile dysfunction is crucial for early detection and intervention to prevent complications and improve overall sexual health. By understanding the common indicators of erectile dysfunction, individuals can take proactive steps to address this condition and prioritize their well-being. Reduced libido, also known as a decreased interest in sexual activity, is a common symptom of erectile dysfunction. Individuals may also experience difficulty achieving or maintaining an erection, which can lead to performance anxiety and frustration. Relationship strain is another warning sign of erectile dysfunction, as the impact of this condition on intimate relationships can be significant and challenging to navigate. Early detection of erectile dysfunction is essential for effective management and treatment. By recognizing the symptoms and seeking help from a healthcare provider, individuals can receive timely interventions and support to address the underlying causes of erectile dysfunction. Ignoring warning signs and delaying treatment can lead to further complications and negatively impact both physical and emotional well-being. It's essential to empower viewers to prioritize their sexual health and seek help when needed. By being proactive about addressing symptoms of erectile dysfunction and discussing concerns with a healthcare provider, individuals can take control of their sexual well-being and work towards improving their quality of life. Maintaining overall sexual health and well-being is essential for a fulfilling and satisfying intimate life. By incorporating practical tips and healthy habits into your routine, you can promote sexual function, enhance intimacy, and improve your overall quality of life. Regular exercise and a balanced diet promote sexual function and overall well-being. Physical activity can improve blood flow, boost energy levels, and enhance mood, contributing to better sexual health. A diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats provides essential nutrients that support sexual function and vitality. By managing stress effectively, you can enhance intimacy, reduce performance anxiety, and enjoy a more fulfilling sexual experience. Discussing preferences, desires, and any challenges you may face can help foster understanding, trust, and intimacy in your relationship. Seeking guidance from healthcare providers, such as urologists or sex therapists, can also provide valuable insights and support for addressing sexual health issues. If you found this information valuable and informative, we invite you to subscribe to our channel, like this video, and share it with others to spread awareness about sexual health. Together, we can empower individuals to prioritize their sexual well-being, seek help when needed, and enjoy fulfilling and satisfying intimate relationships. Thank you for watching, and remember that your sexual health matters.